Clang into a halt.
Hello, everybody. How many of you were in my panel earlier today at 4 o'clock or at 1:45? I'm glad you're here again. That's a good sign. I started my speech this morning by talking about my hypochondria because it was a panel on matching strains to maladies. But I'm going to do a little bit differently this time here. I was asked to give you some feedback before we start. Is that okay? You guys okay with feedback as an audience? Okay, here it is. Okay, that was it. It was positive. Sorry. Anyway, none of you guys are in the audio business. Nobody left. Femi. Is that you back there? Femi? Okay. Femi, are you here right now? Okay. So, let's get going here. So, you're welcome. It was for you. David Traub here. I have, how many people know who I am? Nobody knows me. Okay. I've been speaking at this conference since 1991, and I can promise you that it's not been cannabis that I've been talking about. It's been many, many other things, but one of the ways that businessmen survive in life is they pivot in the direction of the C's. And there's two big C's. One's crypto/blockchain, and the other one is certainly cannabis and CBDs. They're all C's. So today's panel now is about new technologies as relates to cannabis. So hold on one second, please. All right, so I'm from Silicon Valley, Bay Area. I actually live in Sausalito. I got very lucky when I was still at Berkeley, and I got pulled into a company that was doing something called multi-threaded bivariate operating systems. And I asked what that was, and they go, oh, well, some people are calling it Windows. And I said, what's Windows? And they said, trust me. And I did, and we were the first company that Microsoft bought. So whenever somebody says, trust me, I always do, just in case you want to take advantage of me. Silicon Valley has a very interesting group of people that inhabit it. I mean, maybe it's unfair to talk about Silicon Valley, because there's so much innovation that happens everywhere else at this point. Silicon Valley is more of a state of mind. But there's many things that entrepreneurship in cannabis has related to other things. You're solving problems, you're disrupting, you have instant enemies when you come to the point where people hear about you. The interesting thing about the cannabis industry is that the enemies or the people you're disrupting are not just corporations that are kind of big, fat, and happy, or at least content, pleasing their shareholders, but it's also the government that's trying very carefully to steer policy so that it still supports those large corporations. One of the things that was very interesting that came out of our panel this morning, and it was a very interesting panel, we had the woman that basically identified cannabis as a cure for epilepsy, which finally got approved by the FDA just very recently, is that the FDA is only equipped for supporting single compounds that have a single use, that operate with the same people, with all people exactly the same way. Anything beyond that is beyond their capability. And the only hope that the entrepreneurs have in the cannabis world, the small cannabis folks, the people that actually invent the stuff, as always, is to become artisans, is to become artists and focus in those areas where multiple cannabinoids or multiple different compounds can be identified, through mapping anecdotal evidence, because how else can you do it, and find a home by creating cures that can be somewhat supported by maybe genetic testing matched to certain strains or certain products that have proven efficacy over time. Anyway, it's become a very high-tech business, and I've been amazed at some of the technologies that I've been pitched. I've raised a lot of money for folks. I'm a mental health economic development educator through technology and entertainment. I've helped start a bunch of companies. I work with the UN. I've been doing mostly blockchain these days, looking for opportunities in the cannabis space. I do own parts of some cannabis companies. as well, although because I'm a public figure, I've always avoided actually touching the product. But the kind of things that I've been pitched are things like growing cannabis without soil, or listening to people talking about creating products not from plants but from other natural substances that have the same efficacy. And as we started to put this panel together, some of the most amazing people actually came to mind and said yes to speaking with us today. So on our panel today are a number of folks that are going to talk about their experience as technologists, as entrepreneurs, as marketers, and as individuals that have gone to this new field, applying what they've learned in their previous lives to what is yet again a burgeoning market opportunity, very fast growing and very rocky shores because of the shareholder-driven capitalistic players, the corporatocracy that intend to control and own as much of it as they can. On that note, here's how I run my panels. I have everybody introduce themselves because I usually butcher it myself, and I want everybody to introduce themselves properly. And then the next thing that I do is I have everybody share 3 to 5 trends of what they've observed over time, over the last 3 months, going forward over the next 3 months. And then as quickly as possible, we have a conversation. And if you don't raise your hands, I'll raise it for you, because you don't learn just by listening. It doesn't really work well. In fact, one of the biggest challenges they have in Morocco and in northern Africa is they've realized that the format for education, I literally have a master's in education, where the students are not allowed to speak, undermines the capacity for critical thinking. Very bad if you want entrepreneurship to flourish. So please aggregate questions, strong questions, and please aggregate those specific cannabinoids that actually minimize the amount of time you need to express those questions and say thank you, because we've only got about 49 minutes. On that note, I'm going to start moving in this direction, and I'm going to ask you to introduce yourself. We had a lovely conversation today. Introduce yourself relevant to this panel.
Sure,
Julie.
Thank you. Hi everybody, my name's Julie Rocky. I'm the Vice President of Marketing for Cannabis Labs. We are a research and development innovation company with branding support for all of our products in our pipeline that come to market. And part of our business strategy is with our intellectual property, we partner exclusively with one state manufacturer and work with them to commercialize and bring our brands to market. So a lot of what my role is supporting the brand voice on a national level and working with the individual state licensees and their sales teams to find that voice in the local market. I come from 10 years from the dark side of pharmaceuticals. I spent quite a long tenure there working on product launches in orphan and specialty spaces and working in gene replacement therapy, and started to see a lot of the data that was coming along with cannabis from an innovation side. That dovetailed with my started to feel with the managed care landscape, coverage, cost, and access to medications. And in addition to the opioid crisis, I started to gravitate more towards the holistic healing backed by data and science that I was seeing in cannabis, and found this company, Cannabis Labs, which employs extraction scientists from different disciplines of food, beverage, and pharmaceuticals, who are working to bring superior grade products to market that are reliable, consistent, and safe for the consumers. So I've been working with this company for about a year, and very, very excited to be in this industry. And each time I'm at one of these conferences, I just get more energized. There's just so much support behind it, and we're only going forward. So I look forward to being here today.
Julie, were you in the panel earlier today? Did you hear the panel that we had at 1:45?
Yep.
I was a little bit shocked at the degree to which the speakers, who are very significant players, are expressing the sense of doom, or not necessarily definitive doom, but potential doom, as the pharma, the tobacco align behind the FDA, upon whose board they sit, trying to make sure that this industry fits their criterion, which means allows them to dominate. You've been on both sides. I like that you came over from the dark side, so to speak. How are you optimistic for the folks in this room? Because there's probably not a lot of people from pharma in here, but there are a lot of very bright, ambitious, and aggressive entrepreneurs in this room.
I definitely am, and that's one of the reasons I knew that this was the move that I wanted to make. I think that just from my background, I did my master's in pharmacology and studying chemical compounds. The Epidiolex approval was a major step in the direction of advancing medicine, but also advancing the cannabis acceptance and future research and development for the benefits of the whole plant. And I think we still have a long way to go, but what we are doing right now in this industry is something that big pharma, big tobacco, alcohol, they're not yet prepared to do until the FDA acknowledges it. So as long as we keep the momentum going and we keep fighting the good fight, I think as an industry, we really do have an optimistic future in building without the big boys coming in.
And I'm going to make sure that this is all shared and we have enough time for the audience, but one other question. Coming out of pharma where everyone wears these wonderful, nice sports outfits and everybody, it's a very corporate world. How did it feel to parachute into the land of dudes and long hair and dark glasses? Well,
the Wild West. I got the jokes from family and friends for probably the first 3 months, like, do you guys just all sit around, smoke pot all day, and stoner culture? I'm like, no, that's not at all what it is. And I think that when I saw the opportunity that was coming here, and I saw the innovation coming with the science that Cannabis Labs was working on, and that's what I was excited to see, was this company is really trying to bring products to the consumers that feel like they can empower them to take back their control for treating themselves from a medicinal standpoint. Recreationally, they can dose responsibly, and we can provide strong, reliable brands that are going to be something that are going to stay for the long term. And so that's why I made the move.
And it's interesting because as I mentioned earlier, I'm very involved in social impact blockchain, which is all about sovereignty, and self-care is sovereignty. Or sovereignty. So it's very interesting how there are all these different meta trends towards people being able to take care of themselves more and have more choice, even in control of their data. But how long have you been doing this now? How long have you been with this company?
November 4th will be a year.
Okay, so a year. So let me ask you, Matthew, how long have you guys been focused in this field?
Thanks for asking, David. Matt Norgren with Arcadian Fund, representing the group of entities as founder and CEO. Stacy, our director of operations, here as well. Been in the industry since about 2010. One of our old funds was a real estate investment vehicle, and we started to get a lot of appetite from green zones that we had legacy assets in that now all of a sudden had a higher and better use than they did before. And so we got to track the industry from a real estate perspective through 2015 when, as a family office who really likes private equity growth type investing, we started to look for an opportunity. Ended up identifying that in the form of High Times, became part of that acquisition, at which point in time, we really thought the industry was exciting, had been involved in a little while, and launched a fund called Arcadian, to which we've raised a significant amount of capital and been investing in the space for a number of years now, and feeling really good about what we've invested in and the people we've invested in. And hopefully today we can offer you a perspective for somebody who is in this industry very deeply in a lot of verticals and a lot of markets, and provide some macro level perspective on what we're seeing and what kind of stuff we think has a lot of opportunity.
So where I was going with that, and I was misinformed, but it's always beautiful to misassume anything, because life is fun when you're inspired and you have these epiphanies and these deltas. By the way, if you learn nothing from this panel, the delta for humor, the algorithm for humor is the delta between what you say and what people expect. I mean, contemplate that as you listen to me try to be funny. But what I was wanting to say to you was, as an investor, you have a certain archetypal experience that you're used to in technology, for example. They have business plans. Hopefully it addresses the fundamentals. they're trying to communicate a certain level of expertise. What was the cultural experience like for you as you moved on from the real estate upon which they were doing grows to more about the technology, more about manufacturing and products? And have you found that the cultures are reconciling very similar, or is it still a very unique culture?
Good question, David. I think the culture is unique, no doubt about that, but in any emerging industry, they are unique. And the fun thing about being involved in an emerging industry, which is funny to say because this has been around 10,000 years, but is that you get to sort of create that. And that's one thing that I've been taken away from a lot of these conference meetings today, and all the conferences we participate in and speak with. There is a great deal of thoughtful entrepreneurship here. No matter where you came from or how you think about the world, you're accepted in this industry. And for the first time, you have an industry this big that gets to listen to the world and try to do things the right way from the beginning instead of trying to reverse engineer ourselves for things like female empowerment and caring about the environment and different ethnic and cultural backgrounds. Really do have a lot of voice in this industry, so that's exciting. I think it's great to have a different culture from the entrepreneurs and the leaders in this space. I think they're honest and they're open and they think about the world the way it should be thought about. So it's been pretty fun.
I would say that there's nothing more powerful than personal mission embedded in the energy by which you render your business. I also think these are new generations that have been raised by people like me that are very concerned about the world ahead and realizing that their future is increasingly in their hands. And it must be really exciting to be with people that really believe in what they're doing instead of are wanting to raise the quality of their car, for example. And the work you're doing is really wonderful.
Thank you.
I've been tracking some of your deals, and I'm really happy you're here. One of the things that I've observed is that some of the most amazing innovation in this space comes from personal need. Earlier today, Dr. Catherine Jacobson was on the panel. I don't know if she's in here now. Her child has what's called it's a form of epilepsy that's purportedly uncurable. Idiopathic epilepsy. And she actually was a postdoc at Stanford, UCSF, and literally rendered 40% improvement and was told, oh, that's not interesting because it didn't meet the FDA's approval, but this was her child. Started thinking 40% improvement of quality of life. And so there are all these idioms, but it was all about her serving her personal interest. Robert, or my friend Bob Schubring, a dear friend of mine, is a man that's been dealing with pain nearly all of his life and has become a world expert in pain and is an inventor, has a portfolio of patents that he manages.
All right, let's start straightening out some of the facts here.
Go ahead.
Okay, to begin with,
I'm a lawyer, so
I have not been a pain patient my entire life.
No, okay,
okay.
Let's
on going for that one. Okay, next thing. I first actually got involved in this as an investigative journalist. I helped a gentleman named John Hollowak produce a film called High, The True Tale of American Marijuana. It came out in 2008. Some of you may have seen it. You can see it on Hulu if you're curious. One thing we discovered when we were making the film was that an astonishing number of people at the DEA thought that even the legal drugs for treating pain shouldn't really be considered legal. Even the legal drugs should be thought to be a privilege that only a few people should be allowed to have, that most people should not be allowed the right to decide for themselves whether they're being helped or harmed. That was the problem. That's still a problem. And I have to correct you again. When Catherine was dealing with agencies with her son, it was not the FDA that was the problem. It was the DEA that said a 40% improvement is not enough to call this stuff medicinally useful, because they had gone on record that the only drug that actually has helped people with ADHD, namely cannabis, must be bad because Richard Nixon said so. And as a result, children and their parents who believe the DEA's own propaganda continue to give their children addictive stimulant drugs, amphetamines, including methamphetamine, the stuff that's killing people in West Virginia nowadays, in the so-called opioid crisis. We have people dying because they're so messed up on methamphetamine that they can't sleep. So then they become desperate to sleep, and they mix dangerous combinations of drugs together to try to force themselves to sleep. This is where we're at. Now, yes, I'm an inventor. I have some technology up my sleeve, and I'm trying to get a patent. Since we haven't got the patent filed, I got partners who I can't sell out by talking about the patent. So I'm going to talk about my charity work. I got together with another film producer based out of Toronto, a gal named Tina Petrova. We started a group called Give Pain a Voice. And what we want to do is teach patients how to speak for themselves. Because if patients don't speak for themselves, no one is going to speak for them.
Thank you. Cameron, we had the pleasure and honor of sharing a panel 6 months ago. We were introduced through a very wonderful fellow. Cameron has very interesting drivers that brought him into this industry and peripheral industries, but I'm going to allow you to tell the story as you wish, because it's your life. Gotcha. And although I do like getting corrected, because it's a form of attention. I need attention.
Perfect. Thank you, David. My name is Cameron Clucci. I'm the president and the CEO of a company called Kelsey Biotech. We are an IP holding and intellectual property licensee company. We too also come from the traditional pharmaceutical industry, specifically dealing with sensitive active pharmaceutical ingredients, increasing their bioavailability and their stability. That kind of is, I think, what David was trying to kind of allude to. So where the real genesis of the technology came from was dealing with vaccines, especially with measles and things of that nature. I'm Native American, and so that was kind of a very, I would say, dark period, I guess, kind of in our history, especially being from Northern California.
Yeah, it went from 50,000 to a couple hundred.
To a couple hundred,
because they were gifted with blankets that had something on them, correct?
Measles specifically,
right,
yes. But I guess what kind of brought us into this industry was really taking a look at how our different proprietary technologies could be used, and rather than looking at a vaccine as the API, really looking at cannabinoids as the API. So we, over the past couple of years, have really been strengthening our IP portfolio, and then are starting to work with different various either licensees or working with a couple of different R&D initiatives to try and further both the research aspects as well as bring efficacious products to market.
Thank you, Cam. Okay, Elizabeth, I'm glad that we could fix your sign. And so now, in full splendor, please introduce yourself.
Sure. Hi, my name is Elizabeth Ashford, and I'm the founder of a firm called Cirrus Strategies, and we work with companies in the cannabis space to drive legislation and policy fixes to allow them to do better business. I also have a background in politics. I was in Governor Brown and Governor Schwarzenegger's offices for about 6 years, and I was Kamala Harris's chief of staff. I came into the cannabis industry specifically because I saw a real disconnect between the entrepreneurialism that is so intrinsic to the people in this room, and, versus the platforms and the objectives of elected leaders in California. Right now, though, because of how botched the state's licensing system, bifurcation between the local and the state, and the enormous tax rates and all kinds of things, I mean, I really think that California has basically created an anti-competitive environment where the illicit market is just simply going to continue to thrive. So I'm focused much more at this point on looking outside of California, looking outside of even the United States, looking for markets and partners internationally that can actually move the ball forward, specifically around medical research, which is, that's ground zero for what's really going to propel this industry from where it is today to where it will be in 15 years. So.
Elizabeth, this whole challenge that we have really came from I think it might have been Procter & Gamble. I don't remember exactly, or maybe it was Dow. Was it maybe 70 or 80 years ago? Discovered that hemp was competitive with cotton. And it was very much an American corporate activity that made all this illegal. You can correct me in a minute. But I know that you're doing some very interesting work overseas. And I would guess that the attitude over in these other countries who, to some degree or other followed suit with the Americans, because in the old days, the Americans had moral, I suppose we had some moral precedents in the world. I'm not being political, I am. In any case, how is your experience overseas with people with respect to growing and research? I know you're working in some very interesting countries right now.
Yeah, I mean, what we're finding overseas is that it's seen more as a commodity and less as a moral issue. Definitely something where there's real interest in progress and real interest in working with pharma. It's a different culture. There's less of the culture of cannabis and more of an interest in the cannabinoids and the sort of, the marriages that we're finding in terms of these chemicals to really fix problems that mainstream medicine has not been able to fix.
And of course, there are economic opportunities, just like in crypto, you suddenly have Malta, Gibraltar, various smaller countries eating the lunch of people like China, who says no to crypto, and America says no to crypto, more or less. In the cannabis, it's the same. Israel kind of rules the world. Maybe Canada's number 2. A lot of activity in Australia, India, Jamaica, all over the world. So they all see it as an economic opportunity.
There's only 2 countries in the world you can export from easily. That's Canada and Greece. I work with people in Greece. So that's the EU. And that's the next step for a lot of companies that are struggling in California.
Yeah. Okay, speaking of California, Julie, what are your observations of trends over the last few months? What do you see things going that are kind of new? I mean, what's exciting to you, or just the opposite?
I would say, like I mentioned, I've only been in the industry for just under a year right now, but I cannot believe how quickly things are changing and shifting. And because we have a unique perspective, or rather I do, from basically having a national brand marketing strategy, but supporting in-state licensees, I've noticed that per state regulation and compliance from advertising promotion can vary greatly. So I work with a outstanding digital marketing agency based here in California who helps stay on top of the regulations and helps keep us customizing for per state. But California in particular, I think that culturally, cannabis has become more of a wellness lifestyle from what we've been able to see. There's a lot of consumers here in the California market that are using product for condition-specific type of focus. Right now, our first product offering is a combination of cannabis and Ayurvedic herbs, and the consumer profile spans from young millennials all the way to older adult populations looking for something for sleep. So I think from the consumption standpoint, consumers are very proactive in looking for products that meet their everyday needs and lifestyle to live a vibrant, healthy lifestyle. In addition to that, I think from a marketing perspective, just noticing how social cannabis has become, that there's an increase in pop-ups of like coffee shops or cannabis experiential, type of activities, infused dinners, high tea. So it's really become a socially acceptable way to consume and to socialize versus drinking or other types of recreational enjoyment. So from a targeting perspective, there's some unique opportunities that I've seen here in California that we've yet to see in other markets.
From a technology perspective, what have you observed that's innovative, whether it be in, for example, the targeting side, or even in terms of quality control with the company you're working with? Would you say that they're at the same level of quality control than your previous more mainstream employers were?
Well, I think that one thing that attracted me to my current employer was that our cornerstone of our business model is our intellectual property and innovation. So having this development around extraction and process and producing data that is repeatable and can scale is really key. And I think from observing that data and looking at how we've strategically established our partnerships who are able to bring those products to market has really set us apart and differentiated ourselves. And essentially that is our value proposition.
That's great. That's great. I think repeatable is a crucial concept in this business right now. Speaking of crucial, Matt, to what degree are the pitches you're getting, or I assume you're getting a lot of pitches, to what degree are they technological, process-oriented, part of the production food cycle, the production chain, value chain, or are they more about, brands? I mean, so where would you say the pitches are from a technological perspective?
A great question for us. I think, what we set out to do is to help people make those decisions. We really don't operate a company as an investor, and we have investments in just about every vertical you can think about in this industry, from bioscience to media to data to HR and compliance and you name it. I mean, we pretty much touch most aspects of it. So we like to think we have a pretty good understanding of that. To illustrate that point, though, maybe if you don't mind, run a quick test to know your audience better. Do you mind if we just ask you guys, who in here is involved with the cannabis business today? How many people? Oh, that's pretty great. How many people in here are operators of cannabis businesses? Great. How many people are in here are somebody looking for an opportunity to invest in or be a part of in the cannabis industry? Great. And so appreciate that, because that helps us figure out how we talk about this stuff, because when I go to these conferences, it's really important to walk away with things that are really happening daily and perspective on what that means. So I'm going to try not to talk a lot about things you can read and hear about all day. But, that was an example of what type of opportunities are out there. Understanding your audience, data, right? You don't have to grow or sell or manufacture the hemp or cannabis plant to be involved in this industry if your skill set is a data analyst or a software technician, because we need to understand what our consumers think. And before brands can get built, you have to know these things. So to answer your question, data companies are really, really important right now. BDS Analytics is one of ours, and we think they're one of the best out there. So they help us understand what's really happening. Going back to your question you asked earlier, how do you evaluate the industry? It's very difficult because there's not a lot of information available. It's an unregulated industry, not a lot of reporting. The companies that you can dig into public filings on, in large part, are in Canada. Valuations are pretty crazy. So, it's a really tough thing. And what we've set out to do, there's a lot of great people up here, and you've been to a lot of panels, and you see a lot of people that have really amazing things going on. Our job is to spend time with everybody and understand what that means, what the upcoming political decisions mean for those people, and then ultimately provide resources to those companies. So we think data and software are really important. Think that the work that some of the bioscience people are doing are really interesting, because I think brands are ultimately going to be driven by IP. You're going to have some type of unique formula, some type of unique delivery method. I think there's 18,000 registered strains. There's some really good ones out there, but tough to differentiate yourself there. So I think IP and data and software are really interesting. The last thing I'll mention, I think media and events business is really interesting now, because we have a chance to shape this industry moving forward. Haven't even clearly defined brand categories yet, right? So media is really, really important. We're involved with a company called High Times that we're going to be able to announce some really important things and fun things soon. So I think that's an exciting one to pay attention to, David.
Thank you, Matt. Robert, what have you observed from your perspective over the last few months, and what do you see coming?
Well, I concur with Matthew on the importance of media. We're definitely going to need a more informed consumer base who are able to make good decisions about what sort of product they want, and are able to give good comparisons about what sort of product they're getting. I think it's going to be critical for everyone in the industry to do things in terms of quality control. I'll give you an example from an unrelated industry, whiskey. The companies like Seagram's or Hiram Walker that make whiskey, they isolate a particular strain of yeast that they grow in a laboratory and keep to maintain genetic purity, to maintain consistency from one fermentation to the next. Why? Because if some strange bacteria or a mutant form of yeast got in there and started introducing other substances that had a funny taste, and then they aged the stuff for 5 years, and then they sold it, and suddenly the new product that they put 5 years of aging into tasted bad, that would be a major loss to them. So these companies do a lot of work on quality control. We're going to see more quality control. I know I was one of the people in the previous panel was talking about trying to build lighting systems to try to duplicate natural sunlight, try to duplicate natural soils and what have you. I'll give you another example that relates to that. There's a mold called Aspergillus niger. Depending on what you feed it, it makes 3 different products. If you starve it, it makes a poison called oxalic acid, which kills off all the neighboring bacteria so that it can hoard the available food. You give it enough food, it produces citric acid, which is used to make Alka-Seltzer. And if you overfeed it, it produces gluconic acid, which is a kind of syrupy, sugary type thing that's used in car wax. So you can make either of these 3 products depending on how you feed that mold. Now, the cannabis plant is a much more complex organism than a mold. What influences can we have on it in terms of the growing conditions? Well, this is stuff that will have to get figured out. And if consumers are interested in maintaining in the experience, and if vendors want to offer good quality, they have to look into these things. So, yes, there's a remark earlier that this could turn into an industry like craft beer. I agree.
Thank you, man. Cameron, I met you about a year ago, and it's been, I can already see that there's been a lot of growth in your arc as a company. More confidence on the part of your investors, more deeper relationships with your vendors. What are you observing now from your perspective out in Colorado, spending time here as well? Where do you see things, where have things gone in the last 6 months, and where are they going?
I'm going to kind of keep that. I think we're a CBD panel, so I'm going to kind of keep it on that purview. The interesting thing is, with Epidiolex being approved, there was never an FDA oversight of any cannabis product. And so one thing that we've had to start contending with is the FDA is going to start looking at things, because you can't have technically an unproven medical application and a marketing material in the same venue. So for instance, on a website where you're selling cannabis or CBD products, you should not make any claims towards its efficacy whatsoever. You can't even actually have a link to a peer-reviewed article or white paper on that same thing, because now you're crossing the line between marketing and educational tool. So that's one thing that we've had a lot of difficulty contending with, is being science-based. It's like, how do we, without making it seem like we're either a fly-by-night operation or something of that nature, not look back to the, essentially the basis of third-party and peer-reviewed studies that we've used to base our formulations, and also not hide behind the science, which is really kind of going to be a thing lately, effectively from a dosing standpoint, where you say, you have, let's say, 4 million nanograms. Well, that's 4 milligrams. Effectively, it's like people start hiding behind numbers and all these different ways of spinning it in a marketing fashion, that we've started kind of having this issue where we're trying to figure out how to play within the guidelines, essentially, that the FDA is going to start imposing on a lot of the cannabis products or CBD, or hemp products. But in the same fashion as like, how do we continue to educate the consumers without just giving them raw data? And so that's kind of that's been one trend that we've been contending with over the past 6 months.
You know, it just struck me, in the blockchain world, people are getting hacked every day, but you never hear that because there's no regulation, so they have no need to tell you that. And earlier today, somebody was talking about the fact that the state is getting involved, and the incidence of mold and the incidence of some of these other pesticides are being eliminated because there is increasing local regulation. It's interesting, I've never really thought as much about the positive sides of regulation, but can you see a positive side to regulation in this industry?
Absolutely. Well, as we've kind of talked about beforehand, and I think it was Jessica started alluding to the hemp seed oil, essentially craze that's really started to kind of hit. I mean, we've even done some analysis on tinctures that are being sold for $90 and had less than 2 cents worth of hemp seed oil in there with 0% CBD content. So essentially, just from protecting the consumer's standpoint, I think that's where the largest upswing is going to come for this, and it's just going to be the people who kind of stick to their guns and actually make sure they are good actors in this space. And eventually, unfortunately, it'll probably take a couple years for it to weed itself out completely, but I mean, that's ultimately what we're all after here, right? Is actually some sort of an efficacious relief to or augmentation to some aspect of our lives.
Elizabeth, it's interesting that it comes to you now to address trends when you've actually been on the other side. You've been in the policy side, you've been on the government side, and you have very strong compassion now for this industry. You want it to go the right way. You know, how do you feel, you know, how does one navigate those corridors and make sure that the value gets to the people that need it, you know, when it's still such a wild west?
Right. So, I mean, you know, we in California have the advantage of usually getting to pick from a group of politicians that are pretty liberal, or at least now by national standards, even Republican candidates are quite liberal. So I think that, you know, we have that just sort of advantage here in California. On the flip side, we have really onerous regulations. So, I mean, really onerous regulations are going to continue to stifle innovation and, you know, reward going outside of the system. So I think we have to, you know, navigate the corridors of power with, you know, the mindset of business people rather than, you know, the cannabis community. When business people go in to talk to elected officials, they go in with data, they go in with one another, they present a unified front. This industry is self-harming by continuing to turn in on itself again and again and again politically, certainly here, because, you know, if there's a tough decision to be made, a politician is going to look for the cracks between the interest groups and go there. And so, you know, there has to be more professionalism, there has to be more unity, there has to be really more of a sense of, listen, you know, yes, it's cannabis, but also it's a job creator. It contributes huge amounts to local and state budgets, and as such, we should treat ourselves that way, and we should go in and present ourselves that way. Until we do, we are going to be looked upon as folks who are just these outliers. So there's that. And I also just want to emphasize the huge need we have for real data. You know, people are self-treating themselves for debilitating and often deadly diseases without the benefit of any information except what's working for them individually. We have to get research on the table. We have to clear a pathway for human trials. This is number one, because politicians, policymakers make decisions based on data now, not based on feelings. So we have to arm ourselves with that data, whatever it takes.
What is it like sitting in Sacramento? What are these folks like when they talk about it? I know that, you know, Newsom's is pretty liberal, I know, but what are they like, not publicly, but I mean, are they fairly pro? Are they?
Yeah, they are actually, and most of them are using as well. So, you know, it certainly is. I just was at a fundraiser for the Lieutenant Governor Newsom, and you know, his message was loud and clear. He's just like, the best days for the cannabis industry in California are yet to come, but they are going to require adjustments to the regulations. So we're not there yet.
You know, my observation was that California went overboard in regulations in order to be legal before everybody else. So to some degree, it was very self-imposed. But anyway, so here's the part of the panel that I look forward to, and what I've learned is that the only way you can really learn is to address the 5 to 7 problems you have in your mind at any given time, and grab information that's of relevance to solving those problems. So please have a conversation with my associates. I know that a number of you could be up here yourselves, but please raise your hand, and if you don't, I'm going to ask you a question. So who's got a question? Go ahead. That's a good question. That's your business. What's the future of cannabis advertising? Obviously, it would reflect the future of advertising in general, which is not necessarily television. But what are your observations on where the dollars are going right now? And what's permitted on the air?
I was just going to say, I mean, I think it's a ways away from my days of working in pharmaceuticals to have a commercial produced and on television and aired nationally, syndicate. It took a lot to get approval for the content, and it would always have to have fair balance with all the safety and efficacy. So I think until we have controlled clinical trials that document data and support and have primary, secondary endpoints that we would be able to speak to, I don't think that having anything in the public domain at a national level would be allowed. Where I do think we have the opportunity is having a digital footprint. So digital marketing efforts with email marketing in the markets that are legal. We do a lot of social media content. They do have to be state specific with the right regulations in place. But we also look at ways that we can support from having more of that brand voice in a digital footprint where consumers are looking. So product websites, informational collateral that's digital and tangible. But really, I think that is the target for advertising and promotion, but it's the right one right now. I think television commercials are probably a long ways away.
Yeah, I think it's important to make another point to answer that appropriately, which is you need to compartmentalize the amount of product categories that these two plants are going to eventually be involved with, right? I mean, at the end of the day, it's a molecule that can be extracted and infused in anything in the grocery store. As some people up here are spending time on the efforts for over-the-counter and behind-the-counter medicine, totally different categories and regulations. And then you've got hemp, which can do everything from concrete, textiles, fabrics, and hemp fibers are just incredible. So every one of these categories will be regulated differently. They're going to be regulated in different ways in different points in time for different reasons. And it's important to know that that's not just pertaining to North America. We talked about Europe a second ago. We've been there for a long time. We've been in South America for a couple of years, and pretty soon can announce some things in India and China that are really, really big. You've got 40% of the world's population there that's about to do some things with hemp. A lot of product categories to be thinking about, and you just have to pay a lot of attention to when regulatory bodies allow for you to do certain things. One of our companies we're involved with is called Kush Company. It's a packaging and bottling company, trade on the OTC market. It's a great business. Every day we get a different direction that the company has to go in some market because they change the way things have to read or what they have to say. I mean, there's a lot to be figured out on every vertical. I hope that, not to talk about High Times too much with our portfolio of great companies, but in this aspect, I think High Times has an opportunity to continue to do some things like it's doing with acquiring and partnering up with other great media and event vehicles that have voices in different ways. And if we can get that thing out in a big way, I hope it does more of that. And then as a stronger group, as a bigger group of a lot of voices, I think we can go in and fight those battles a little bit tougher and a little bit more efficiently for all of us that need to figure out what that is.
I know that High Times is certainly does a lot of advertising around delivery systems, vapes and things like that. But to what extent are you receiving a lot of requests to advertise edibles or products? I mean, What is the inflow like? On
Yeah,
the
great
business?
question. As a non-operating partner at these companies, I'm not in the best position to answer that specifically, but in general, we're starting to see a shift that doesn't necessarily mean market shift from people that consume flower to edibles or tinctures or, I'm not doing so well on hair these days. I've got a little topical on the hair. Where do these products come from? They're unbelievable. It's not that we're seeing a shift from people leaving products they already like. It's that the market size is growing. And so as an addressable market, we see percentages growing in all these other product categories. And I think the media is starting to reflect that.
Okay, great. Terry, do you have a question? You are good. Another question. There you go.
CBD products and some of the fly-by-night, turn-a-buck type companies. The consumer who doesn't know if there's a Yelp out there or the Consumer Reports, how can they better educate themselves to know the difference between high-quality brand and low-quality?
This is a great question, and this is a trend that came up in the earlier panel too. Is how can we aggregate the anecdotal information of what's good and what's not good? And I don't really know what's out there. Matt, maybe you might have seen things simply because you're in a position to be pitched this kind of stuff.
Yeah, we've seen a lot of it. There's companies that are the WebMDs of cannabis. There's the exchanges that are starting to come up that are B2B exchanges, B2C exchanges. And, data, as we've all talked about, is extremely important. I think, you'll see more of that. The options are somewhat limited now, but they're also limited because, as we talk about, there's not a lot of information for us to provide information to you that's accurate. So, as that continues to be made available, I think you'll see more businesses setting themselves up to relay that to the consumer. But again, it depends on your product category. If you're a medical, if you want Epidiolex, you need to go to a certain place to have someone tell you that's what you need, versus if you need a CBD knee cream because you have some knee problems, probably a different resource for that too. Versus if you're going to buy hemp concrete or hemp, fibers or something like that, someone needs to tell you what's good and what's efficient for you there as well. But the real answer is that we don't have enough data on a lot of things to do that, but as we move along, you'll just continue to get more of it.
Does anybody, go on.
Can I just add to that? So one piece that I would suggest is that at the point of sale, not to underestimate the power of influence and education for the bud tenders, because consumers are curious and they may be walking through those doors for the first time, and it's a really consultative type of interaction. And so we as a company are trying to do our due diligence to even go back to include almost a 101 of THC, CBD, to speak to these different pieces of the plant that the consumer knows what they're looking for, but they don't know what they're asking for. So they're looking to the bud tender to help educate and walk them through that buying process. So I think that that's another piece to, while we don't have great data or reliable data per se in this industry just yet, I think the bud tenders are really the gatekeepers of informing the curious consumers who are walking through those doors.
Not to take too much time on the panel, but another point worth making is that what we find is really important is that whenever someone is curious about what we're all doing, that we meet them wherever they are, whether that's, they're in inning one or they're in the seventh inning with their knowledge base. We continue to remind ourselves that no conversation is too unimportant to have, and just meeting someone where they are and talking about it is the first step.
Does anybody in the audience have a technology they're developing for accelerating growing? I know that, Sin, you have a technology that replicates the various bands of the sun so that you can so you can simulate outdoor growing indoors in various ways. I see that you have a question there.
So we have technology for development for NASA to grow crops in space. It uses stem cells from plants. It's a patented product. So the America, they've used drops in the water, and they want their animal top twice.
Really? This is NASA plants. Right.
But anyway, we subsequently tested metabolic pathway that pharmaceutical grade additive to CBD is now detecting toxins as well as dead cells. And it's all validated. We have tons of data in this. So I'm in the process of creating the first FDA regulated pharmacies that are testing our product. We test. So yes, the answer is you can go look at our website. It's a public listed company.
And the question I had, the reason I asked that question is, do you have a challenge that you have right now that the audience might be able to, or might?
They know more about the subject. My background is really catching this stuff, so you need help with people like that.
Great. Last question, anybody? Go ahead. No, Kat? Okay. Thank you very much. Thank you for being here, and thank my panel as well. Thank you so much.
Yeah. Covered a lot of ground. Yeah.